So that was obviously a video that was prepared by the California Endowment. And when you think about, who's leading on what California needs in the healthcare realm, when you think about what are the most principled and important and effective voices for healthcare in California, the California Endowment is on the top of any list that anyone would put together. I can honestly say that in the short time I've been in California, the opportunity to get to know the leadership of the endowment, to get the benefit of their counsel and their advice and their thinking has really been something that's incredibly important for our organization. The leader of the California Endowment, that tall, good-looking man in the video, is Dr. Bob Ross. Bob is somebody who, when I first came to California, he didn't know me, I had never met him, and we asked to come in and sit down and get to talk to him. He made time, he was thoughtful, and what I discovered instantly the first time I ever met him is that this is somebody who gets it. When you talk about you got to get it in the heart before you can get it in the head, Bob Ross shares our values. Bob Ross is a pediatrician by training. He was a public health leader in San Diego before he went to lead the endowment. If we're going to be successful in the next 2 years in transforming Medi-Cal in this state, it will be in large part because we get the benefit of this incredible organization and this incredible leader. I really am honored to be able to introduce and present to all of you somebody who I have great admiration for. He's also just a good guy to hang out with. He's fun. He is not a stick in the mud. He is a doctor. He is a thinker. He is an activist. He is a principled person. Please welcome Dr. Bob Ross, the leader of the California Endowment.
Thank you so much, Dave. Let me, I think I'm the last thing standing in between you and lunch. Okay. So I'll cut my comments to 95 minutes. No, kidding. Thank you so much, Dave. I want to thank and acknowledge, first of all, colleagues that we've worked with. Another round of applause for our partners and colleagues from the California Medical Association, Dustin and Mark, his great leadership at CHA, and Carmela Castellano, who's been a partner in crime for us from the very beginning. Thank you, Carmela, for your great leadership at CPCA. I want to thank our board of directors at the California Endowment. They're the ones who provide both the support, the guidance, and the leadership to allow us to invest in so many of those young people because the leadership of California is in those young people, and we're not waiting for them to be leaders tomorrow. They're leaders now and leaders today, and it's our board of directors that pushes us and nudges us and cajoles us to believe in them and invest in their future and their possibility and their potential. So a round of applause for our board of directors, and our chair, Dean Germano, is here. Thank you, Dean. And then lastly, my team here at the California Endowment, in particular our Sacramento team, I call them the Hole in the Wall gang. Daniel Zingali and Richard Figueroa are Butch and Sundance. I think Rich Fig may be gone, but Daniel Zingali's here. A round of applause for Daniel Zingali. Thank you, Daniel, for your leadership. And then, of course, your leadership and Dave Reagan. Dave has become a friend and a colleague. That was some presentation that you heard from Dave Reagan, was it not? Dude had me looking to put on a purple shirt, man. Fill out a card. You got one for me? Okay. But that's real, clear-eyed, risk-taking leadership you're seeing from Dave Reagan. And that's the kind of, I'm going to come back to that being more of what this state needs in a second. I just want to say a few things, mostly to affirm the direction that SEIU-UHW is heading in. Let me start with a little bit of context. I threw most of my main talking points out based on what I heard this morning. Last week, my wife and I celebrated our birthdays by going to see John Legend at the Hollywood Bowl. And with a couple of close friends, and it was a great evening. And what was even greater about it was that John Legend featured a musical tribute to Marvin Gaye. And for those of you that are old enough to know who Marvin Gaye is, you know how much that would mean to us. If you're 30 years old, you can have someone who is 55 years old explain that to you, who Marvin Gaye is. But what was great about the evening, at one level, it was just a great, wonderful, entertaining evening. Sitting under the beautiful summer moon at the Hollywood Bowl, bottle of wine, my wife and John Legend and Marvin Gaye, and the music was great. He did the entire very famous The What's Going On album, right, which was, and it was wonderful. John Legend as Marvin Gaye was just extraordinary. But what was also interesting were a couple of things. One is, it reminded me of hearing the words to that album, What's Going On, again, 30 years later, right? 35 years later. And the timelessness of the messages in that Marvin Gaye album, and that was the music, that was the message of our time. If you're near my age, which is very close to 60, right? If you're in your 50s and older, and you remember the messages that were laden in that music, right? Marvin Gaye and Stevie Wonder and Joni Mitchell and Jimi Hendrix, right? And it was about how our generation at that time was fed up with poverty and fed up with inequality and fed up with racism and fed up with injustice. And I assumed at that time, being 20-something years old, that when we got around to being in charge, we would fix it. Right? You too. When we get around, when it's our turn to be in charge, we're not going to have that anymore. We're going to fix poverty, and we're going to fix injustice, and we're going to fix racism, and we're going to fix inequality. Now, I'm not here to say that we haven't seen any progress since then. We certainly have. But we still have poverty. We still have, you just heard, a young woman, full-time in school, full-time job, working 3 kids, playing by the rules, busting her tail, serving her community, and gets hit with a $2,000 bill she can't pay, that she should not have to pay in this country, right? There's something wrong with that. That was happening in 1974 when Marvin Gaye asked, what's going on in this country? And here we are 40 years later, and things are better. But we should not have that story in this country. We should not have that story in California, right? But we still have that story very much with us. And so it had me, even though it was an enjoyable evening, certainly listening to the music, it had me thinking, you know, it had me thinking about my generation and what we've not done. The generation that raised me, our parents, our grandparents, at least if you're anywhere near my age, they defeated Nazi Germany. They brought us the civil rights movement. Right? The generation that followed my generation brought us the information technology revolution. They literally changed the world through technology. And it had me feeling like my generation, are we just sitting on our butts? What are we doing? What are we doing to move opportunity forward, to move justice forward, to move social change forward, to move hope forward? What are we doing? Well, what's interesting is that we're on the cusp here in California of making some real significant strides. There are about 4 or 5 things that are happening right now that are critical that we must do, that we've got to deliver on, and I'm going to end on the one that you're here about today. But one of them is folks need a better wage, right? We have profits going this way and prosperity going that way, right? Americans are not more prosperous generally, although profits are up from a corporate perspective. So we're beginning to see movement and conversation around raising the minimum wage, and we need to make sure that we continue to move that forward, right? The second issue which we brought up, which came up in the video, is our children need access to excellent education, okay? And it is a wonderful thing. One of the things that California has done this year, and we have to give our governor credit for this, was for the first time bringing a change in the funding formula for public education that provides more dollars for low-income children, for children in poverty, for children whose English is a second language, for immigrant children, and for children in the foster care system. The financing formula now recognizes that those children need more help, not less. Okay? Now, Dave Reagan, I'm going to ask a favor of you and UHW, because that policy just got implemented, the law just got passed, but now we have to make sure that those dollars actually do follow those children. And so, Dave, if we could have UHW working with us to make sure that you've got your eyes and ears, making sure that your children and the children of the families that your communities represent are benefiting from those additional equity funding, equity dollars, and that it's translating into better graduation rates and a better educational opportunity for those children. So the dollars are there. It's in the budget, but now we have to make sure the dollars follow the children, right? Another thing we have to do is we need to dismantle. I'm back to Dave's comment about incrementalism. We need to dismantle, we need to blow up, we need to obliterate the school to prison pipeline in this country. This pipeline, which has voraciously engulfed, in particular, African American and Latino young men in this country, and taking them out of their communities and putting them in jail, even for minor offenses. We need to turn that around, and there's actually a ballot proposition which I cannot endorse legally, but that raises this issue. It's coming up on the November election ballot. I think it's Prop 45, 45 or 47. 47? No, it's not 44. Okay, it's one of those 40s. But I don't know whether that ballot proposition will pass or not, but the conversation is on the table about revisiting this issue of the school-to-prison pipeline and making sure that we're holding young people accountable and responsible, but giving them the support they need. And by the way, we need to stop suspending kids out of school. Let me stop that. You can hold kids accountable, you can give the support they need, but don't throw them out of school. That's the last thing you want to do is to put them in the street. Okay? That's part of the school to prison pipeline. All right? We need to make sure that people have the ability to marry whoever they want to marry. And we need to make sure that, as my friend Carmela Castellano mentioned, that the undocumented Californians and undocumented Americans who are contributing so much to this country and paying taxes, that they are recognized with some semblance of dignity around their health care and access to health care. We need to finish that job. So in order to move opportunity forward in this country, those, you know how you have the to-do list on the refrigerator of the 5 or 6 things you need to do that day? Those are the 5 or 6 things that are on the list. And then there's health reform. Okay? And so there's no secret that, I know it's cause for celebration, and we should celebrate the good things. California led the nation in implementing health reform. Okay? We are leading the nation. That's not an accident. That's called leadership. It's leadership from UHW, SEIU. It's leadership from the clinics who signed up and enrolled so many people. It's leadership and support from the doctors and from the hospitals and from the health plans. It's leadership and support from the legislature and the governor. Okay? Leadership, coalition building does matter. That's why we led the nation in the first year of Obamacare implementation in enrollments. But now we have to build on that. And I am so thrilled to see, through the combined leadership of SEIU-UHW and the California Hospital Association, and we will be happy to join as partners. We've been partners with UHW already. This will be the next chapter of our partnership. We have to fix Medi-Cal. Medi-Cal is a key fundamental program that has been, and this is an old head expression, the redheaded stepchild of the healthcare system for a long time in the state of California. Okay? One of the things we need to do, and Dave, I'm sure this is what you have in mind by bringing us all together, when we say we need to fix Medi-Cal, we need to come to some agreement about what fixing Medi-Cal means, right? What does that mean? You know, just like my wife and I could have a discussion about we got to fix this house, but she may have a completely different version of what that means. Yeah, I may be thinking about the roof and she's thinking about furniture. Well, what do we mean by fixing Medi-Cal? Okay? Well, I'll give you an example that's going on right now. Okay? So at the California Endowment, we provided some resources, some additional resources through the leadership of our board of directors, our great chair, Dean Germano, vice chair, Jane Garcia from Clínica de la Raza. And we made some dollars available to help assure that Obamacare implementation in the state of California was successful. Right? Among the items we did and supports we provided were dollars for Medi-Cal, outreach, education, and enrollment, because Medicaid has been expanded through the Affordable Care Act. And so last year we provided, in this particular case, a $26 million set of funds through the state of California to be matched with federal dollars, another $26 million, so you have a total of $52 million for Medi-Cal outreach. That's one of the reasons why California led the nation in expanded Medicaid coverage. Okay, so that's good news. Our board of directors also offered $6 million for Medi-Cal renewals, because we know the renewal issue of Medi-Cal has been a 20-year problem in the state of California. If you can get on, it's hard to stay on, and it'll make it easy for you, right? Lots of forms, lots of reporting, lots of this, a lot of paperwork, lots of that, right? So we made some dollars available to be matched through the state. We'd give $6 million. The state would take the money, match it with federal funds, and then we would do renewals with that $12 million, right? That's $6 million plus $6 million. Right? Well, don't applaud yet, because the state hasn't accepted our money. Now, I've been at the California Endowment 15 years. I don't remember offering anyone a $6 million grant and they said, no, thank you. That's never happened before. The reason why the state of California, as of yet, we'll find out in the next week or so, is because of this issue. When Dave and others talk about changing the narrative of Medi-Cal, that's this problem. That's this problem. They don't want to take, or some people don't want to take, our $6 million because the narrative is more money in Medi-Cal helps bankrupt the state budget. In other words, investing in a health program for the poor, the working poor, the underserved, those who can't afford health insurance otherwise, who are trying to make an honest living, investing in that program is seen as a deficit, a problem, rather than being an asset or a good thing for the state. So when you talk about changing a narrative, that's what changing the narrative in this case means. That putting more money into renewals and outreach from Medi-Cal is actually a bad thing rather than a good thing for the state of California. You see what I mean? So our $6 million is now sitting there, the offer's been made, and we don't know whether the state of California is going to take it up. The governor may sign the bill, he may veto the bill, we don't know. But that's part of this narrative change thing, that Medi-Cal, which is the workhorse, a key workhorse of the healthcare system in this state, doctors don't want to talk about it because they can't get paid, clinics don't get reimbursed on a timely basis, hospitals are losing money by serving those patients. We make the program difficult and cumbersome for patients and consumers because it's hard to sign up. They make it even more difficult to re-enroll. Lots of forms, lots of this, lots of that, a lot of bureaucracy. It's seen as a welfare program. It has the stigma of a welfare program rather than as a vehicle to improve the health of Californians. We need to change the narrative of Medi-Cal from a problem to that of an asset and a benefit for the future of this state. That's what changing the narrative around Medi-Cal means, and that's why Medi-Cal, every time, I guarantee you, the hospitals will tell you this, the clinics will tell you this. Where's Dusty? The doctors will tell you this. The next time there's an economic downturn and the budget has to get cut, what's the first thing on the list? Medi-Cal. Cut the provider rates for Medi-Cal. Guaranteed. Every governor's done it ever since I've been in California. I've been in California for 20 years. Okay? And so when Dave talks about mobilizing a political advocacy strategy for Medi-Cal, even though it's good to have the data and it's good to have a rosy, bright health future for the state of California, to talk about how important Medi-Cal is to that. Back to Frederick Douglass, power concedes nothing without a demand. It never has and never will. We need to get some power and advocacy behind the Medi-Cal program because it is so important to the current, the present, and the future of the state of California. That's the narrative change. That's the shift. And to this day, until now, no one has taken up the leadership mantle of saying this is a problem that must be solved until Dave Reagan and the very good folks right here in this room, SEIU-UHW, said, you know what, we got to call the truth on this one out and we got to put it on the table. Okay? And so we have an opportunity, if we're willing to get, and I'm going to close by quoting one more musical artist. This is a more contemporary artist. Seal. It's a great song. I love his song. The title of the song is Crazy. Okay? Download it. Has great lyrics. But the main lyrics of the song go something like this. Seal is basically saying the same thing as Marvin Gaye with everything that's going on in our world, poverty, racism, and inequality. We're going to have to get a little bit crazy to survive. In other words, if we stick to doing business as usual, we're not going to make it. And so his theme is, in order for our world to survive, in order for us to do better, we may have to get a little bit crazy. We may have to try some things that we've never tried before. Like UHW, SEIU, and the leaders of the hospitals coming together on an agreement. Right? But in the song Crazy, Seal also talks about being that kind of crazy is scary. It's risky. Because the last stanza of his song say, you know, in a world full of people, only some want to fly. In a sky full of people, only some want to fly, right? Because that kind of risk-taking is a scary place. It's a new and scary place. I think what you heard from Dave is, you know, there's a saying about taking risk. People talk about what the downsides of taking a risk are, it's because it's a scary place. But there's a risk to doing nothing. And sometimes the risk of doing nothing, of letting things be and go the way they are, is actually worse than the risk of doing something and taking a chance. And so this is why I applaud you, UHW, you, SEIU, you, Dave Reagan, for doing something a little bit crazy, for being willing to fly and take that risk that in the state of California, when the rest of the country looks down on gay people, California stands tall. When the rest of the country looks down on the undocumented, California stands tall. When the rest of the country looks down on Medicaid, California stands tall. So this is our moment to show the nation what real opportunity, real hope, real optimism, real action looks like. Let's get crazy. Thank you, SEIU-UHW. Thank you, Dave Reagan.